So my journey started around 9 years ago, where am working with an organization called Asha Ki Kiran. And we started, when I joined this organization, there were about 300 children who were who had congenital issues, namely mental retardation, Down syndrome, uh, cerebral palsy, deafness, mutism, and the list goes on. So, and many like brachiocephaly, pseudo orchidism, and many of these issues. So this journey has been 9 years, and I've been working on them. So what we do is we target the pregnancy history of the mother, especially in three. We've divided it into 3 trimesters, and we try to find out what has happened in the womb of the mother when what has happened, what has changed the epigenetics. So, like for example, the first 3 months, it's the time when the anatomy forms. So if there is a conflict or a Uden in the first 3 months, the anatomy of the child would be altered. So probably a loss of a part, or probably a malformation of a part, or probably some other anatomical defect. For example, cleft palate, or probably something which has not been formed. So in the next 3 months, in the second trimester, it is the physiology which is being formed. So during this time, when there is a Uden, there will be a problem in the physiology of the patient. Okay, something like sickle cell anemia, hemophilia, or something. All these congenital disorders will be addressed at this time. Now, the last trimester is the most significant one, because that is the time when the functionality starts taking its effect. So any disorder which we have to address the functionality would be targeted at this time. So for example, a mother faces a Uden and she goes through a fear episode, okay, or a fright episode. So, and with the second episode, that may come with the mother itself, or after the birth of the child, we'll find autism. So very interestingly, I'll share some cases of Down syndrome. We are still working on them, and with few doctors, they have found a breakthrough. But with my 1 or 2 cases, we yet have to do the karyotyping done. So the conflict of the Down syndrome will not be like it's written in Dr. Hammer has written that it is because of the audible, because of the ultrasound and all that. No, that is not true with us. What we found out was the conflict of autism is found on the 7th or to the 12th day, between the 7th to the 12th day of the last period before conception. What happens is there are 2X chromosomes and 2Y chromosomes. Okay. So on 2X chromosomes, what happens in Down syndrome? There is trisomy of the 21st chromosome. Why tri? It should be 2. Why is it 2? Why is it 3? So at this period, before the conception, the chromosome does not divide. And so 2 chromosomes attach, the 21 chromosome attach, and then another one comes and attaches. So it becomes a trisomy. The conflict at this time, what we found out is majorly attachment in mothers. In 10% cases, it could be fathers also. And attachment so that there's a case of Down syndrome. Now this mother got pregnant in May. She had a very strong attachment with her brother's son. She wanted to have a child who would be like her brother's son. And the brother's son was born in August. So just see the belief system. She had a belief system that if children are born in August, that's the best part, because I will get a child like my brother's son. It is not possible. If the child has been conceived in May, he cannot be born in 3 months, or he cannot be born in the next year, 14, 15 months. So it's not possible. So it is the attachment. The pregnancy though carried on, but she had constantly this in my mind. I wish it would have been August. I wish it would have been August. The result was the child was born with Down syndrome. Typical mongoloid features. He could not do anything. And I do have his videos also. Not the latest one, prior to this one. So this child has started walking. He started taking out his shoes. The expression on the face of the mother in the video is like, "Oh my God, he's doing it on his own." You just see the expression on the mother's face, and that is it. What you think that, okay, this is what I was born for. So and I thank God for it that I've been given that opportunity. So now he's going to school. He started communicating. Everything is better. First thing what started was his irritability. So we told the mother, he's going to be irritable. Don't ever think that you are going to harm the child, that you are going to stop his irritability. The irritability means that there is some reaction in the child which has started. So now the irritability has also gone down. It is just that he has a typical, slightly lesser mongoloid features. I'll wait for a year or some time and then get the karyotyping also done.